Hello, health detectives. Welcome to All Things Autoimmunity. If you have any strange allergies, if you have an autoimmune diagnosis, or if you have more than one autoimmune condition, you have come to the right place. My name is Dr. Michael Smith, and for the last 30 years I have practiced and taught integrative medicine. And for most of the last 20 years, I've also studied and taught various forms of embodied trauma release and addictions therapy. I have found the combination of functional medicine, traditional Chinese medicine, releasing somatically entrained trauma, learning from addictive behaviors, and resolving the modern epidemic of cyclic burnout to be the most effective in caring for complex and lifelong conditions. I am also an autoimmune patient. I was diagnosed with Crohn's disease many years ago and have lived with that condition mostly successfully ever since. I've had a few serious flare-ups over the years, which have been part of the driving force for much of my research and for much of my self-experimentation. As an author and researcher, I am presently working on the second edition of my cookbook, Returning to an Ancestral Diet, and two other books. This one is the first edition. It's a 600-page cookbook with 500 ancestor-approved recipes. Watch for the new edition. It's coming out soon. It'll be a bit smaller. I'm also going to be publishing finally this manuscript for 10 Steps to Abundant Health, which is a self-guided cleansing and rejuvenation process that I've used to support people on a yearly 10-week deep dive into their health and healing. And we've been working with this manual for about 25 years, so it might be time to get it out there. And finally, I'm almost ready to publish the Epigenetic Autoimmune Protocol, which should be available in about 6 months, and you're going to learn all about what's in that book in this video. As I finish each of those books, I'll have a lot of new articles for my website and a lot of content and YouTube videos for you. If you and I have just met, in the sense that you're not familiar with what I do, I practice and teach a very specific protocol for autoimmune disease. So this approach to resolving complex chronic conditions is actually based on the innate process of wound healing and the process of downregulating an exhausted and dysregulated immune system. As I go into this video, you're going to find everything I talk about on my website, and it's very easy to find, it's very step-by-step, and there's a lot of decisions that it's important that you make for yourself. So the Epigenetic Autoimmune Protocol has 4 phases. The order you choose for these 4 phases is up to you. But for most of us, we start in phase 1 and progress through the process step by step. And for some of us, we start at phase 4, so we have the most dietary options as possible, and then we work our way backwards. So I'm going to explore that a little bit for a couple of minutes. I highly recommend working with an experienced clinician, because it will almost always save you a great deal of time and a great deal of money. As well as the 4 phases, we also have what are called the 6 pillars of health. And in each of the 4 phases, it's important for you to design and decide what you're going to do with each of those 6 pillars. So depending on your lifestyle, how serious your medical condition may be, what you're open to, how you choose to navigate your life, these pillars of health and your individual preferences allow you to design a protocol that will hopefully work for you in both the short term and the long term. Again, working with an experienced autoimmune doctor will ensure that you're making the best choices for your specific situation. And the only thing left to know, really, is where you fall in the autoimmune spectrum. Now, this spectrum is something that different clinicians may describe in different ways. I use a 5-stage process, and you can see what that looks like on the screen. Where you land on this spectrum will almost always determine how you organize your journey through the 4 phases and how much you're going to need to go on perhaps a deep dive into each of those 6 pillars, because you want to self-design your protocol for exactly where you are, the momentum of how your health or illness is moving, your age, and many other factors. It's very, very important that you make this unique to you. The processes and sequences that I recommend are only meant to be a map. It's important that you place yourself on that map where it makes the most sense to you, in the sense of which phase you start with, the direction you go, the duration you maintain for each, and perhaps how much you focus on each of those 6 pillars. That is important, that it's really up to you. And again, those decisions should be made based on where you land on that autoimmune spectrum. And one last recommendation that I would make to anyone is to consider taking an autoimmunity
predisposition questionnaire. And these questionnaires will go through your entire health history from the moment you were born and before, how you were born, how your health was for the few years of your life, what happened in puberty, and on and on and on. And all of those distinctions tell us exactly how likely you are genetically and epigenetically to either bounce back or have a harder time recovering from any autoimmune condition.